Hi, my name is Veronica Caradine. I will be talking to you regarding health history and interview. That's what my assessment will be on today. I will be interviewing Miss Debbie Miller, and she is a 58-year-old white female. I also want to tell you before I get started about some of the things that you'll be seeing during the interview, which is subjective and objective data. Subjective data is what the patients say that they see or they might have feelings. Objective data is what you see or you might hear during your interview or your assessment on your patient. Also, we're going to start the interview on with open-ended questions. This right here will lead the patient into the interview. You want to ask them what have brought them into the hospital today or what brought them into the clinic. Our setting that we will have today will be in the clinic. And now we will get started with our interview. Hi, Ms. Miller. My name is Veronica Caradine, and I'm your RN for today, and I will be doing my health history and interview questions for you. First thing, I'm going to be writing some information down. So when you see me writing, that's what I'm letting you know what we'll be doing. I'll be asking you questions about your present health history, your past health history, and also about any surgery or anything that's going on, like just smoking or drink alcohol, okay?
Okay.
All right. What brought you into the hospital today, to the office?
Stiff joints.
Stiff joints. And how long has this been going on?
Off and on for about 7 years.
When was your last time you seen your doctor?
It's been about 6 weeks ago.
Do you smoke?
No.
Okay. What about, do you drink any type of alcohol?
Very rarely.
Okay. And what do you mean by very rarely?
Well, maybe once every 6 months or so.
Once every 6 months? When you do drink once every 6 months, do you just drink a pint or just a bottle of beer, whiskey, wine coolers when you drink?
No, it's just a drink.
Okay.
A regular drink. It's nothing excessive.
Okay. All right. How do you drink coffee or tea?
Tea and colas.
Okay. How often do you drink coffee or tea?
No coffee ever, but
Okay.
tea probably about twice a day.
Twice a day for tea? And what about your colas?
Maybe 1, 2 a day.
2 a day? And you drink these for 7 days a week?
Yes.
Okay. When you do drink your sodas, your cola, do you feel like when you don't drink, do you feel like you have a headache or anything?
Slight.
Slight.
Nothing serious.
Okay. I'm gonna ask you these questions. Have you ever been exposed to any of these type of chemicals, like toxic chemical exposure, like your house cleaning or anything like that? Do you wear a mask when you're cleaning your home?
No.
Yeah. Okay. Do you? What about your indoor? Do you have indoor plumbing?
Yes.
Okay. What about, do you live in a crowded conditions?
No.
Okay. Are you allergic to anything?
Just allergens in the environment, like
Okay.
dust and mold.
Okay. Have you been to an allergy specialist?
Yes, a very long time ago.
Okay. And what type of medications are you taking?
I take Synthroid, 50 micrograms every day.
Okay.
I take Norvasc, 5 milligrams a day.
Okay.
I take Plaquenil, 200 milligrams twice a day.
And I'm going to ask you something about your past medical history also regarding some conditions, medical conditions. Have you ever been diagnosed with heart disease or heart murmur or have any chest pain?
No.
Okay. What about problem with your cholesterol? Have your doctor ever tell you had a problem with your cholesterol?
It was slightly elevated, and I took fish oil.
Okay. What about problems? You did tell me that you take Norvasc, and that's for your blood pressure, correct?
Right.
Okay. Never had a problem with low blood pressure?
No.
What about heartburn, like you have a burning sensation when you eat any type of food?
Very rarely.
What about problem with anemia or your blood?
None. No problems.
Do you have swollen ankles?
No.
Do you mind if I look?
No.
Okay. Have you ever been diagnosed with having an aneurysm?
No.
Okay. Shortness of breath?
No.
Thyroid problems?
Yes. Hypothyroid.
Hypo? Okay. What about lung problems with a cough? Have you been noticing you
No.
having a cough? Sinus problems?
That's allergy related or seasonal.
Seasonal, okay. Depression, have you ever been diagnosed with depression or had any
No.
type of anxiety? Ear problems,
No.
excessive wax or drainage?
No.
What about skin problems? Have you noticed any different thing with your skin?
Age spots
Age spots?
related to exposure to sun. I'm more careful now.
We make sure that you put sunblock.
Yes.
What about eye disorder, glaucoma, cataract?
No, I'm just nearsighted.
Nearsighted. Have you had any problem with your kidneys?
No,
What about your bladder?
no,
Okay. Liver disease?
no.
Headaches?
Not really, other than
You have migraine?
no.
And what you mean by not really with your headache?
It's nothing that's on a regular basis or persistent. It's just every now and then.
Okay. Nerve problems?
No,
What about ulcer or colitis?
no,
Okay. Have you ever had any psychiatric care?
no,
Lupus?
no,
What about diabetes?
no,
Have you been diagnosed with seizures?
no,
What about had a stroke before?
no.
Arthritis or gout?
The arthritis type is painful joints. I have Sjogren's syndrome.
Okay. Have you ever been diagnosed with cancer?
No.
What about have you ever had tonsillitis?
Had my tonsils removed.
Okay. When did you have your tonsil removed?
1977.
What about asthma?
No,
Is there any other condition that was not mentioned in the health issue that you would like to tell us about on your past?
No.
Okay. I want to ask you something about your vaccinations. Have you ever been vaccinated against hepatitis B, or you been treated for that disease?
vaccinations.
Vaccination, okay. And when, do you remember when it was the vaccination?
No.
Okay. What about rubella,
Yes,
whooping cough?
yes,
Okay. Rheumatic fever?
no.
Okay. Chicken pox?
I had chicken
You
pox
had chicken, and you don't know.
when I was in the 5th grade.
Fifth grade, okay. What about measles
Vaccination,
vaccination? Okay. Mumps,
vaccination.
shingles? Have you ever had shingles?
No.
Okay. And when was the last time you have you ever had a TB shot before?
I've had negative skin tests.
Negative skin test, okay. Can you tell me about any current or past medical treatment that was not listed up, that we have not discussed?
I've had an appendectomy and a cholecystectomy
Okay.
and right carpal tunnel release.
Okay. Have you ever been hospitalized? Were you hospitalized for any of these procedures?
Just outpatient.
Outpatient. Okay. Can you tell me when your last dental exam?
It's been within 6 months.
Okay. I'm gonna have to ask you these questions regarding your female problems, since we do have menstrual cycle now. Are you currently pregnant? Are there any possibility that you might be pregnant?
Definitely not.
Okay. We still have to ask these questions. How many times have you been pregnant?
Once.
Okay. And how many births have you had?
One.
Okay. Do you know when the last time you had a pap smear?
Within a year.
Okay. So we're saying probably July 2016. Have you ever been told that you had an abnormal pap?
No.
When was the last time you had a mammogram done?
That's been 2 years.
2 years ago? Okay. And was it normal or abnormal?
Normal.
All right. The next question I'm gonna ask you about your family history. So these mostly gonna be like yes or no questions, and then I'm gonna ask you about if they had passed on or anything like that. So, what about your mother? Has she had any problem? Is she living or
She's alive and she has congestive heart failure.
Okay. What, your father?
He died when I was 12.
Okay.
He had COPD.
What about your sister?
My sister died when she was 52. She had MS.
MS. Your brother?
He's alive.
Okay. And he doesn't have any health problems you're aware of?
He has some kind of heart issue, but I'm not sure what it is.
Is there anything else you would like to tell me and inform me about before, when we come into the end of our, health interview and our discussion? Is there anything that you would like to let me know about? Or do you have
No,
any
you've pretty
questions?
much covered everything.
All right, thank you, Ms. Miller, I really appreciate it.
Thank
Have a
you.
good-